Hi, I'm Dr. Joe Nemeth, and I am a periodontist in Southfield, Michigan. How do you know, if you're home, how do you know if you may have a dead or dying tooth and you may need a root canal? Well, there are a number of things usually we find with a tooth that needs a root canal. If you're not at the dentist's office, obviously you probably don't have an x-ray machine at home. So if you tap that tooth, kind of like this, you can take the end of a toothbrush or tableware. If you tap the tooth, tap on the tooth, usually a tooth that needs a root canal will be sensitive to percussion. Also, that tooth may be sensitive when you chew on it or when you bite on it. The tooth also may be sensitive to cold. One of the tests we use here is we take a little piece of ice and we hold it with some gauze on the tooth. If it needs root canal, very often will be very, very sensitive to cold. Sometimes it's heat, but more often cold. Sometimes the gum at the base of the tooth, at the root, the base of the root on the bottom or on the top, the gum may be swollen or puffy or tender or uncomfortable. Or there may be a small hole in that gum and pus comes out of that hole. You may not see the pus, but if it's infected, that pus may have to have a way of getting out, and so it forms a drainage, and it's called a fistula, or there may be a pinhole there through which pus comes out. Well, how do you tell the difference between just a cavity and if you need a root canal? Well, typically, just a cavity is not so painful. In fact, you may not be aware of it at all until that cavity gets so deep that it actually reaches the nerve. And when it reaches the nerve, then the nerve becomes inflamed, undergoes a process of dying actually, and you get an infection at the base of that tooth. And that's usually where the infection is. It's usually at the base of the tooth, at the bottom of the root. If you press on the gum by the base of the tooth or the root, it may be tender. Problem is, you don't want to let a cavity go until it reaches the nerve. So it's important to get regular checkups, because if you have a cavity, the cavity could be deep. And if you get it taken care of before it reaches the nerve, it'll save the necessity of having a root canal. Because if you have a root canal on a tooth, then you have to have a crown on the tooth, because the tooth becomes brittle. And not all root canals are successful. We've seen root canals that years later may fail and get infected, and then the tooth has to be removed. But some of the common ways of telling if you need a root canal or not, again, are percussion, pain on biting, sensitivity to cold, swelling or tenderness on the gum at the base of the tooth. You may need a root canal. So see your dentist, and see your dentist anyway, because why not prevent the root canal instead of needing it? At any rate, take good care of your mouth, because if your mouth's not healthy, you are not healthy. We want to hear from you. Comments, questions, subscribe to our YouTube channel. More importantly, have a good day.
Restore your smile and your health. Visit drnemeth.com to schedule your appointment today.